see, so we handed out the weekly data. So you can see that the number of cases are up just a little bit, both in Minnesota and Clay, but just cumulative cases, not active cases. We had 92 deaths now in Clay County. There's a 91 last week, so another reported one on our data, a few more across the state of Minnesota. Our active cases, the good news is we're still seeing a decline in those. It was 167 last week, and now we're at 129, so that's great. We're also seeing a reduction in our hospitalizations. So across the state of Minnesota, they're about 30% down over the last 2 weeks. So that's really good that we're seeing the numbers go down. And part of that, of course, is the number of people that are getting vaccinated. So that's the number of vaccines we get out, and the measures, the continued public health measures are helping that. So the cumulative active the active cases are on the next page, Clay County active cases by age. So it's the 20 to 24 that continues to be the most active cases. And then the cumulative ones, the highest now is that 30 to 34. And again, that will vary as we go along but in those age categories, but it's the younger group that we're still seeing the cases in. The cumulative cases by zip code, we added that a couple weeks ago, so there's an increase of the cases in Moorhead is the largest number, of course, and a few more in Dilworth, increase from the previous week. And then we talked about the hospitalizations. I don't have the specifics for Sanford and Essentia on the Fargo side, other than they're continue to not see the increases and are seeing some decreases now in the hospitalizations and ICU hospitalizations as well. We've heard about breakthrough cases, and those are the ones where people are immunized, and then they have a breakthrough case. There's about 1,200 that the state has data about, and that's 1,200 out of about 1.6 million people. So 700 of those just experienced symptoms, and 70 out of the 1,200 were hospitalized. So it's still, a low number of breakthrough cases, but they are happening. The variant cases are still circulating, so we're seeing that, of course, in variant cases with people that have had some international travel. So about 23% of the Brazil variant was associated with international travel, and about 28% the South African variant. So some of that is still circulating because of that international travel. But we're watching that because it appears that there still are a little bit of a threat for their severity and illness. And of course, we see that Mexico is still a high-risk destination. And obviously, we've seen the news on the devastation and tragedy in India with the COVID variants. I think that's all I have for now, unless anyone has questions on the data, and Jamie will talk about our vaccinations.
Good morning, Jamie.
Morning. Well, we continue to bring the data from Minnesota to you for Clay County, and looking at the people with at least one vaccine dose in Clay County, we're at 39.9% according to the Minnesota data, and we talk every week about that we are feeling that that's not a true reflection of what's going on in Clay County because of those that are served on the North Dakota side, and then people who have completed the vaccine series, 34.2%. And then we have the breakdown by age group to see the 16, 17-year-olds are only at this point able to receive Pfizer vaccine, and we're at 292. I believe we are at 270. So not a big increase in those that are accessing the Pfizer vaccine. there, and then where we seem to be the strongest in Clay County, the 50-plus with at least one dose of vaccine, 50 to 64, 48.4%, and the 65 and greater, 74.9%. So that's where we're seeing the best response and reporting in Clay County. And then just compared to the statewide data, and statewide in Minnesota, people with at least one dose of vaccine are at 60.3%. And then those with a completed vaccine series are at 49.1%. And then the age breakdown there as well. So that, and then we did bring the zip code data again for you to just take a look at by zip code and the response for vaccinations. And then what we do each week is we bring you the doses administered by Clay County Public Health, and we're just over 14,000 that we have administered ourselves, 14,041. Last week, I mentioned that we continued to see a decline in first doses, and so last week, our total doses administered were down to 291, and we were sitting well over 1,000, so we've seen a decline. Our team met this week to talk about the slow decline in those first doses are what we're seeing as very limited second doses. So the uptake is less. We are going out to some locations to offer vaccine. We've been to some of the schools for the 16, 17-year-olds. And you probably heard that Pfizer has been approved for the 12 to 15-year-olds as well. Governor saying this week, we don't easily access Pfizer, but are expecting that we will get some. We had a conversation. We meet weekly with the school superintendents, and we had a conversation last week about opportunities to use that vaccine in the schools, summer school programs that they're having, and then also summer activities. So we're anticipating being able to serve them through the districts.
Jamie, are you planning on Clay County Public Health administering some of those shots, or are they looking to go to other facilities for these kids?
So are you talking about for the kids? We are. Hopefully there'll be a lot of opportunities, but for us, we would really focus on going to the communities and the school districts and serving them through their activities and summer school programs, more than likely.
Will there be a process then that the schools will go through for parent approval?
Yes.
Okay.
And we did that same process for the 16, 17-year-olds. So we pushed that out through them, parents' consent. And, you know, we did have some at the school, but the majority of the parents were bringing the students to the comps themselves. So, and then this week we have 550 doses. Not that we think that we will use all that, but since last week we've been advertising Johnson & Johnson, and we do have that available to sign up and also to walk in as well.
So people can just walk in now?
Yes, we've been advertising each week that, you know, they have a few options. They can register in advance. They can use the QR code when they get there and register, or they can walk in and we'll do a paper copy. The paper copy is not the most ideal for our staff that have to enter it in, but we're trying to be flexible and have been doing that weekly. Johnson & Johnson is on Thursday from 10 to 3. We have some Moderna vaccine for first and second doses, but also Johnson & Johnson available.
Is Thursday the only day?
Thursday is the only day. We're actually doing a clinic on Wednesday as well. And we've got some Pfizer second doses that we're doing, and then also Moderna.
Okay. Commissioner Gross.
I mean, it shows that the people that aren't vaccinated, the younger ones and stuff, are working class pretty much, what you can see. But when we're open with these clinics, we're always open during the day while they're working probably. Do we have any clinics in the evening hours that, like from 6 to 9 or something like that? Do we do any of that stuff?
We haven't gone that late. We've gone as late as 6. Now, this week on Wednesday, we have a clinic until 5, but last week we had a clinic until 6. Mostly because when we have those doses left in the bottle, so we don't waste them, we work really hard. It takes us additional staff time and effort in order to use those doses so they don't go to waste. So, but again, you know, that's something we could certainly consider if that's a barrier. But
I mean, I don't know if we get more people or not, but it seems like our working people, I mean, the age group, younger group and stuff like that, They're the ones that are not getting the shots, but we're not making it available to them probably when they're available. We expect them to take off from work or, I don't know.
Yeah, and Mr. Chair and Commissioner Gross, we have offered it to businesses. So particularly with the shifts, we'll go out to the businesses and have done that. In fact, this morning Cheryl went to a business and had to be there at 6 to meet the staff that were on the night shift. So we are trying to be very flexible in getting that out to them.
Good point, very good, thank you.
Any other comments or questions? Thank you for your continued good work.
Thank you.
Thank you.
All right.